Hey everyone, welcome back to the Vital Signs vlog, your go-to source for family health insights and pediatric care tips. Today, we're addressing a common parental concern. Is anesthesia safe for kids? If your child needs surgery under general anesthesia, it's natural to feel nervous about pediatric anesthesia risks and child brain development effects. But advances in technology and medications have made pediatric anesthesia safer than ever, with low complication risks. Drawing from pediatric anesthesiologist Lauren Licina MD, we'll cover anesthesia basics for children, safety stats, potential risks, and how to prepare kids for anesthesia to ease fears. Let's start with the basics of general anesthesia for children. General anesthesia sedates kids so they sleep through surgeries or procedures without pain. Pediatric anesthesiologists monitor vital signs closely, adjusting anesthetics based on a child's age and weight to avoid excess medication. Pediatric anesthesia has evolved since the first recorded case in 1842, when kids were treated like miniature adults, not ideal due to body development differences. By 1930, specialized techniques and equipment tailored for infants through teens emerged. How safe is pediatric anesthesia? Research highlights increasing safety from technology and medication advances. Over 6 million children and 1.5 million infants undergo general anesthesia yearly in the U.S. Recent studies over 8 years show no behavioral or cognitive deficits in kids with few anesthetics exposures. Specialized training for youngest patients further boosts safety. While risks are low, anesthesia risks in children exist, especially with repeated or lengthy use under age 3, per FDA warnings on potential brain development effects. Note, this is based on non-human studies, and isolating anesthesia's role is tough amid other brain development factors. Ongoing research explores connections between child brain development and anesthesia medications. But multiple general anesthesia exposures often stem from serious conditions needing immediate surgery, like congenital heart issues, bowel obstruction, intestinal twisting, congenital lung lesions, cleft lip or cleft palate, undescended testicles, birth defects such as esophageal atresia, gastroschisis, pyloric stenosis, diaphragmatic hernia, or cancer. Delaying here risks more than anesthesia. Always prioritize life-threatening needs. Anesthesiology guidelines suggest delaying elective surgeries until after a child's 3rd birthday to minimize risks. Discuss the best approach with your healthcare provider for your child's situation. For limited anesthetics use in kids, including infants and toddlers, studies show unlikely harm, with common side effects like mild nausea and grogginess. Does your child need a pediatric anesthesiologist? Not for all surgeries, but recommend one for lengthy, complex procedures or kids under 3. Preparing kids for anesthesia eases anxiety. The worry before surgery is often hardest. Be honest. Explain what happens before, during, and after, using age-appropriate language, even for toddlers. Empower your child to ask questions. They're in charge of their body. For needle fears, options like gas masks before IVs or numbing medicine can help. Ask if available. Write down questions for the surgery team to clear your mind. Bring comfort items like a favorite stuffed toy, blanket, or books for distraction. If anxiety persists, healthcare centers offer relaxation techniques or emotional support. Remember, anesthesia is very safe for kids with low complication risks. Don't let fears overshadow necessary care. If this vlog calmed your concerns about pediatric anesthesia safety, general anesthesia for children, or preparing kids for surgery, like and subscribe and comment. What's your top tip for easing child surgery anxiety? Stay informed and healthy. See you next time on the Vital Signs vlog. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Rangeline behind Starbucks. American Family Care. The right care, right now.